group studies aging-related research questions. We all know people who stay healthy at older ages and some who develop lots of chronic diseases at younger ages. We currently don't really understand why some people age more rapidly biologically than their chronologic age. So our group studied a group of people who were living in Olmsted County, Minnesota, who had received a computed tomography scan or a CT scan as part of their clinical care to better understand how tissue age contributes to biologic aging. I'm Jennifer St. Saver. I'm a professor of epidemiology at the Mayo Clinic, and our paper is titled Older Tissue Age Derived from Abdominal Computed Tomography Biomarkers of Muscle, Fat, and Bone is Associated with Chronic Conditions and Higher Mortality. It will be appearing in the June issue of Mayo Clinic Proceedings. Working with our colleagues in radiology, we studied a group of people who were living in Olmsted County, Minnesota, who had received a CT scan as part of their clinical care. Using these scans, our colleagues in radiology used artificial intelligence methods to measure fat, bone, and muscle from these scans. And we saw that some people had body composition measures that seemed younger than their chronologic age, while others had measures that were older than their chronologic age. We created a composite measure from these measures of muscle, fat, and bone, and found that people who had a bigger gap between their biomarker measures and their actual chronologic age were more likely to have a number of different chronic conditions, including hypertension, heart disease, and chronic kidney disease. We also found that people who had a large gap between their biologic age, as measured by these CT biomarkers, and their chronologic age, were more likely to die in the next about 4.5 years of follow-up compared to people whose biologic age and chronologic age matched up more closely. These results showed that we can measure underlying body tissues without having to do something like an invasive biopsy. And we're also finding that since these measures are associated with aging outcomes, some of these measures that are collected just during the course of clinical care may be useful for providing more information to patients than you could get based on the reason that they were having their clinical visit. So when you go get a CT scan, you get exposed to radiation, and you're getting that CT scan for a specific reason. It's usually to diagnose something that's going on physically. But those CT scans also come with a lot of other information. So we might be focusing in on your knee, but it is also picking up some of the tissues that surround the area that's being studied. And because of that, we can gain further information maybe about what's going on biologically that you're not getting when you're just focused on one specific area. So many of these studies are designed just to better understand what other types of information we can get from these images that are collected for a specific reason that could then be used potentially in the future to help perhaps diagnose some conditions that are not immediately recognized or to better understand the biology of aging. In the future, we plan to expand our research to other organs within the body, including things like the kidney. We expect that measures derived from CT images of these other organs can be added to these body composition measures to better understand underlying biologic aging. And we encourage you to read this article for more information.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.